I'm sitting with the renowned psychiatrist Dr. Manu Arora. Hi sir, how are you?
Hello, how are you?
I'm fine. Dr. Manu Arora has been a psychiatrist since past 18 years. He's done his training from Central Institute of Psychiatry, Ranchi, and then he's worked in Australia, and now he's recognized in the state of Jammu and Kashmir for his achievements. So sir, what inspired you to take up this profession?
See, once you are in MBBS, you're doing MBBS, you're exposed to most of the fields.
Right.
That includes medicine, surgery, gynecology, dermatology, and psychiatry. The posting in psychiatry and medical profession, like when you do as an MBBS, is a very small posting.
Okay.
But definitely for that small time, when I was in posting for, let's say, 15 days and some amount of clinics, I did have an understanding that this is a field which is a person like who does MBBS is not exposed fully to.
Right.
And probably it attracted to my personality in the sense that I thought that just writing medicines is one part of being in this profession, but
Right.
it's something more than just writing medication. You need to interact, you need to understand, you need to understand the personality of a person, and all that attracted and all that I thought that possibly I'll do something in this field, and I was fortunate enough to get a place in a very prominent institute
Yes.
of India. That's a Central Institute of Psychiatry that is directly run by central government.
Oh, amazing.
So most old hospital as well.
Okay.
So it was initially called as European Mental Asylum,
Okay.
then followed by changeover to Psychiatric Institute in India.
Okay. So anxiety and depression are at a rise.
Yes.
And I read an article in which you wrote by 2020, Jammu will be a land of depression.
Yes.
So what do you mean by that?
See, depression is not a new disease. It's not a new disorder. It
Right.
has been always present. It was as old as humanity is.
Yes.
And contrary to what a normal understanding is, that people normally believe that this is a phase in which people go into depression. Yes, this is.
Yes.
But it has always been present, and some fluctuations have happened over a period of time.
Okay.
But as has happened in Western societies, and the same thing is being happening
in India.
in India, metros followed by second-tier cities like Jammu, and people are exposed to a multitude of stressful factors, multitude of responsibilities, a number of things to, like for example, like all of us, we are in a number of roles, responsibilities.
Yes.
Our families have shrunk. We stay alone. We have children who are exposed to just one or two persons. They do
Right.
not have any socialization. So this has happened over a period of time. That somehow in the last couple of years there has been a trend towards increasing prevalence of depression. So it was always there.
There. Okay.
But there is some amount of increasing prevalence which was seen in Western countries, now followed by metro cities, and now cities like Jammu. So I always predicted about 10 years back that there will be a time, and I still predict that this time is coming and we are going through
Yes.
that time, and it is a high likelihood that we see those times increasing over a couple of years.
Couple of years. And so what are the stress factors these days the youth is going through?
See, I think the responsibilities and the role change is one of the major factors which causes us to think about what normally a person should be in that position. So if a person is normally being educated, so a lot of responsibilities are happening. If a person is a working woman, there are other responsibilities. There is no buffer system which happens in society, which was initially present
Okay.
in any societies. Like we were a closed bound society. We had a lot of help, we had a lot of friends and families, a joint system. So that has probably becoming less over a period of time, and it is very high likelihood that this will even further decrease over the next couple of years. Now most of the families, they prefer being into a nuclear family. So the role has changed from being collective responsibility to an individual responsibility.
Yes.
The role has changed from being a collective way of celebration to an individualistic way of celebration.
Yes.
So that I feel it is good. Like once it is things are happening in the right way, you've thought, then things are happy.
Yes.
And the moment you do not, the things do not happen the way you like it to be, and then things start swirling down, and a person really gets trapped into negative set of emotions, and finally leading to a biological state which is called as depression.
Depression. So is it because of genetic factors or environment plays its own role?
See, any psychiatric disorder, not only depression, but most of the psychiatric disorders, there are three contributions to any illness.
Okay.
So could it be depression, anxiety, schizophrenia, bipolar, whatever it is. So since our behavior is normally uh, governed by a number set of things,
Right.
so similarly disorder is also governed by a set of a multitude of factors.
Okay.
The model which is normally understood as psychiatric model of understanding and causing mental illness is psychosocial model.
Okay.
So there are three aspects to it. One is biology, one is psychology, and another is social factors. When we come to biology, the genetic factors are important in terms of biology. Certain hormonal factors are responsible for biological factors. There are certain medical reasons which can be responsible for depression. The personality what we carry, the self-esteem what we have, the friends we carry, the understanding of how the world is happening around us. So that is a part of a psychology.
Okay.
The relationship, friends, multitude of other factors, our buffer systems. So there are certain social factors. So a single factor is unlikelihood that a person with a single factor goes into a really bad depression. But when once a person has a contribution from each one of those, then it's unlikely that a person lands up into depression. So there are certain psychological reasons. I have certain biological predisposition because of genetic factors, and certain social factors also happen at the same time, and a person goes into depression.
Okay. And so what is bipolar disorder?
See, most of the people, they do not understand there is a difference between what depression and what
Yes,
bipolar disorder
bipolar
is. So these are two different disorders.
Okay.
A person who suffers from depression normally has low mood, feels bad,
Yes.
feels suicidal,
Yes.
does not enjoy life, goes into a hell lot of negative emotions, and he fights out with those cognitions for a long period of time before he's recognized and treated. Normally, depression is a recurrent disorder.
Okay.
So a person has an episode of depression which lasts for a couple of weeks to couple of months
Okay.
with the help of treatment. Sometimes even without treatment, some hormonal change happens in the brain and person comes out of a depression and comes back to normalcy.
Okay.
And what happens over a period of time, after a couple of years sometimes, a person goes into another episode of depression.
Okay.
So multitude of factors leads to an episodic depression over a period of lifetime.
Okay.
So this is what is called as depression.
All right.
But in contrary, what happens in bipolar disorder, as the name suggests, bipolar means two poles. Bi means two and polar means poles.
Poles, yes.
You see a football field, there are two poles.
Two poles, yes.
So there's a high pole and there's a low pole. So in these episodes sometimes alter with each other. There is a phase in which a person is overexcited, over energetic, over talkative, sometimes spending more than what is required, being social, spending a lot, and then finally goes into an irritability and sometimes buying sprees. So that's a high phase of mood which lasts for a couple of weeks.
Couple of weeks.
Yes.
Okay.
Sometimes a person commits something which is not his own personality. And at some other. So what happens in bipolar disorder after this phase of high feelings, that is called as euphoria, and a person is energetic, so which is called as manic symptoms.
Okay.
A person can have at other point of time depressive symptoms. So a person alternates between a phase in which there is a highly excitable mood and a phase when a person goes into a really low mood, as what happens in depression.
Okay.
In depression, person does not goes into a high phase. So that is the difference. So it's either a normalcy phase or a person goes into depression. But in bipolar disorder, a person goes into a depression and a phase of high, which alternates, or sometimes a succession of depression and succession of bipolar phases happen.
And sir, we have read it in articles and on Google, women are more prone to depression.
Yes.
What's the reason?
See, on an average, if I suggest what world literature and what we see here, women are almost twice as likely as men to suffer from depression.
Twice as likely.
Yes. So lifetime prevalence, so when I say about lifetime prevalence, it means what are the chances of a normal person going into at least one episode of depression over a lifetime. So that is about 5 to 10% in men.
Okay.
So it is a high likelihood that 1 in 10 to 15 males will at least have one episode of depression during their lifetime.
Okay.
In females, it is double. So it's about 10 to 20%.
20. Yes.
So 1 out of every 5 females, it is a high likelihood that they'll suffer from an episode of depression during their lifetime.
Okay.
one episode at least. They might have a multiple episodes, but at least an episode, which is a very high prevalence. See, when I say a person going into depression, it does not mean that person is feeling low, only low. All of us, we have phases when we feel not that energetic, we feel sad, blue, whatever you might call it as. But there are times when somehow the biology of the brain gets involved and a person starts feeling low to a degree that he is unable to work, he is unable to enjoy, a person does not feel good, he cannot or she cannot go on with the responsibilities, a lot of suicidal or death wishes come, and a person is in a really miserable state which lasts for a significant period of time. 1 day of sadness is not depression. 2 days of sadness is not depression. It has to be a couple of weeks consistently and constantly for a person to be called as suffering from depression.
Okay. And so what are the treatments, different types of treatments you give to patients with depression and anxiety disorder?
Since the causative factors are not one, so the treatment is not uniform for everybody.
All right.
So if a person suffers from typhoid, so you know that this antibiotic is a treatment for typhoid and he goes in a physician, right? So that is not what the case happens in depression. Since it's a multifactorial reasons for causing depression, so the treatment might vary from one person to another.
Okay.
So predominantly 3 modes of treatment, whether a social manipulation or any social change in behavior can cause an improvement of depression. For example, there's a poor marital relationships, and that is the only reason for depression to happen and to continue. Possibly some change in the relationship with the partner or some suggestions so that their relationships improve possibly can lead to a improvement in depression. So a right suggestion by a counselor, a right suggestion by a psychologist or a psychiatrist after evaluation is what might require at all.
Okay.
For some people, some change in the way you look at the world, the way you perceive world, and the way your psychology is. So some changes which is called as behavior therapy or cognitive therapy. The way you understand your thoughts, they are analyzed, they are put forward, they are discussed with the client, and then certain errors in thinking, they are identified, and if you correct those errors, and if a person does it well, some change in that thinking might lead to improvement.
Okay.
For some people, when hormones are predominantly as a playing role for causing depression, when it is really a genetic depression, when it is really a biological depression, and for some people, later in stages when depression becomes really severe, suicidal, agitation, you require a medical treatment.
The medicines,
yes.
They don't work.
So there are antidepressants. Contrary to the normal belief, antidepressants are not sedatives.
Okay.
So most of the people, they believe that psychiatric medications are sedatives. Sedatives is just one class of medication, not all classes. So antidepressants predominantly are not sedatives. Okay. So many antidepressants, they are taken in the morning. Rather, they might interfere with the sleep.
Okay.
So normally when people come for treatment to us, they believe that we are going to give sedative, which is not the case. Okay. Sedatives are used for a minority of patients who are agitated, who are aggressive, and sometimes who require sedation for a brief period of time.
Okay.
Long-term treatment in psychiatry with sedatives is not at all.
Not at all, no. Okay.
So sometimes, depending upon what the case in depression is and how much biological factors are prominent, so treatment might vary between biology, psychology, and social factors.
So you basically make a case study and
yes. So any patient is being evaluated in these 3 lines, like what is the type of factors which are causing depression.
Yes.